So, hi, Dr. Eric. I'm Dr. Anmol. And so today we'll go for a candid conversation with you. So, just tell me about yourself. Who is Eric?
Oh man, that's a very philosophical way to start a conversation. I think the best way to describe myself, as I say on Twitter, is I'm a guy who just fixes holes in things.
Okay, so that is your tagline,
Yeah,
fixing all the holes.
I fix holes in things. Yep.
Right, right.
Occasionally, I make them.
Okay, great. So, before medicine took you in, what were your plans? What were you doing?
Well, I grew up in a small town in Pennsylvania called Scranton.
Okay,
If you ever watched the TV show The Office,
yeah,
that's where
yeah.
The Office is from. Um, I always wanted to go into medicine. I'd never really had any other career plans. I didn't know that I wanted to be a surgeon until I got to medical school. Um, I was actually pretty bored my first couple of years, my first year in medical school, because it was, basic chemistry and stuff that I had already done. I almost dropped out because I was literally very bored.
Oh,
But I always enjoyed anatomy lab, and that was the main thing that kept me going. I would spend late nights and maybe early mornings in the anatomy lab doing dissections on cadavers because I like working with my hands. And I think that once I realized that I liked interacting with patients, obviously, but once I did a surgery rotation, I realized I can do these interactions and I can use my hands and develop an actual skill to fix people. I was pretty sold at that point. Yeah.
oh,
I mean, the idea that you can, in a couple of hours, with a skill that you have, this is a thing that is inside of you, fix another person, to me was just remarkable.
great. So this once you started your surgery rotation, and then it just hit you that this is what you will be doing for the rest of your life. So who was that surgeon which who maybe was there at that moment and everything clicked?
Yeah, well, I mean, it was my very honestly, I mean, my very first surgical rotation. I knew, I I had just started the surgical rotation. I sent a message on a beeper to my chief resident. It was a guy named Eric Henneke, and I messaged him and I said, "Hey, I'm your student on service. What time should I meet you tomorrow?" And he said, "What do you mean tomorrow? We're operating now. Come on down." And I was like, "Okay." So I went down to the operating room, and they were doing, it was a perforated colon case on the trauma emergency service, and I scrubbed in and I assisted with an operation. Uh, he was covered in blood and stool and
Everything.
everything. I mean, it was running down his. It
Yeah.
was He had Crocs with holes in the top, and it was in his socks. Okay, and we finished the case, and we took the patient to the ICU, and we went back to the locker room, and he took off his dirty socks with his hands, and he threw it in the garbage, and he just put his shoes right back on. He didn't wash them. He
And
didn't do
just
anything.
oh,
He just put his shoes back on, and then we went and saw the rest of the patients and made rounds. And for whatever reason, this absolutely crazy moment, I just said, I want to be this guy
yeah.
who is able to do these things and just remain completely unfazed in the face of chaos. And from that moment, I think I was pretty much sold. Like I just, and there were a variety of other senior residents who had a similar personality where I said, like, I want to be that person.
I think the line which you said, that remaining unfazed in the state of chaos, I think that's a beautiful thought. So, how were you as a student in the school in your early days before you joined medicine?
Um, I mean,
You were a good
yeah, I
kid,
think I was a, no, I think I was
rebel
a,
kid.
yeah, I was a pretty good student. I mean,
Okay.
my parents sent me to school a year early because I talked a lot and I asked a lot of questions. In fact, when they took me to register for school, they said he's a year early. We don't think that he should come. And my parents said, just talk to him for 5 minutes, and like you'll change your mind.
So you were a curious kid then and a curious surgeon now.
Yeah, I think so. I think so. And again, I think that um, as I was going through surgery, the areas of surgery that I was most interested in were always novel and unique things. I like vascular surgery because I was training at a time when vascular surgery was changing from open procedures to endovascular procedures. And I like the idea of wires and tubes and catheters, and how do you do, big things through small incisions. What I didn't like about vascular surgery was vascular patients. They're not my favorite kind of patients, yeah. And so once I realized that you could sort of do similar things with minimal access laparoscopic surgery, and with advanced endoscopy, and have the ability to create and develop new procedures, again, I was pretty much
Sold.
all in. Yeah.
All right.
Yep.
So, who was your mentor, or the guiding person, not in the surgical or the medical field, but in your family, or early days, a teacher or family member?
Yeah. Well, my mom is the one who I think got me into medicine. She is a registered dietitian,
Okay.
but growing up, she did that. But in my more formative years, she actually worked as a trial coordinator for cancer research trials.
Oh.
And so my high school was directly next to the hospital where she worked. They like shared a backyard, and I was able to actually take some courses for credit at the hospital. So I would go over for lunchtime lectures on oncology, on surgery, and then I was even able to go over and watch some operations, in the
Oh.
operating room, as part of my high school education.
So maybe that made directed your vision to become to take up medicine and be in surgery later on.
Medicine for sure. Again, at that point, I had also shadowed an internal medicine doctor for quite a while. And I was pretty sure going into medical school that I was going to be an internal medicine doctor. I didn't like surgery. I legitimately didn't. I was actually very scared to be in the operating room. The first time I watched any surgery, it was an open right colectomy.
Oh, I still remember that.
Oh yeah, yeah, because I passed out. I remember I got very, very dizzy, and they had to the nurse had to take me out of the room and stick a cold cloth on my head. I remember that, but the other thing that I remember, which again resonated with me, was the surgeon. He made an incision, and he said, "Oh, this patient isn't royalty. Do you know how we know?"
Oh.
And I said, "His blood isn't blue." And he stopped operating, and he looked at me and he said, "We can teach you surgery. The terrible humor you have to be born with." And so I thought, oh, great! This is this is kind of funny. It also reminded me. Have you ever seen the TV show MASH?
I haven't seen.
Yeah, so MASH is a comedy set in the Korean War, at a mobile army surgical hospital, and it features several physicians, surgeons, again, sort of unfazed in the wartime setting. They made a still in their bunker to make alcohol. They crack jokes constantly. I mean, constantly making jokes while they're literally being bombed. And again, the idea that you can maintain a positive attitude and make jokes even when things are going horrible is part of what drew me into surgery, like that idea of composure.
Great. So you are basically an adrenaline junkie and someone who is good with humor.
I think they balance each other out. Yeah.
Yeah.
I have a set of rules of surgery, which you can find on Twitter. I think somebody posted them one time. I don't really advertise them, but it's in our resident handbook. And one of the rules is be the coolest person in the room at all times.
Right.
And it doesn't mean be cool. It means you have to maintain a sense of composure, right? Like a duck. You see a duck moving across the pond, it looks very calm. But if you look under the water, it's paddling. It's paddling a lot. It's very chaotic under the water. And so I think that even when something is going wrong, if you want it to go even more wrong, you panic, or you let other people see that you're panicking, because then they're going to panic as well. If you are able to be in a very challenging situation and be calm, so calm that you can make a joke about it, I think that goes a long way. It helps other people say, hey, we're going to get through this, we can handle this.
Absolutely. I think that is a very relevant point. So you are basically a calm surgeon who never scolds in the OT? in the ORs, or you do scold your residents and the junior
The
doctors?
only person I yell at is myself.
Oh,
Yeah, and I mean, people don't learn when you yell at them.
right.
I mean, they just emotionally shut down, right? There's no point in trying to correct a terrible behavior in the moment, and certainly not with yelling. It just doesn't work. So I'll yell at myself, but really nobody else.
Okay, so apart from surgery, what, like, okay, so I'll ask one more question in this realm. So, in any moment when you've been in this career for so long, have you ever thought that maybe you shouldn't have taken surgery?
No, I mean honestly not. I think that has to do with how my career in surgery goes, though. I don't like doing the same thing repeatedly. I and so my career as an academic surgeon has given me the ability to have weeks and months that are different from
Your
place to
regular
place and
surgical
time to
work.
time. Yeah. So I mean, we're here in Mumbai right now. Last week, I was there in Hershey operating. I did some hernia surgeries and I did some endoscopies. So very different types of surgery. I did some teaching. I did some research. I had some meetings. Then I traveled to teach. And so uh, if I had to go and do the same thing or the same kinds of surgeries every day, week in and week out, I probably would get bored. I just,
Absolutely, yeah,
I'm not that kind of person, but the way I've crafted my career in surgery, I think matches my personality pretty well.
great. So, what apart from surgery gives you calm and peace? Once you're back from your OR at your place and you had a very tough day, what gives you calm? How do you calm yourself?
I love cycling,
Okay.
and so I found this later in my career. My senior partner told me that he cycles, and he told me, I think you would like doing this. And so I bought a regular bike with a flat handlebar, and I was cycling around, and I was pretty quickly sold. And now I just buy bicycles more and more often.
Oh, so you have a collection of bicycles with you.
Yeah, I believe the rule for owning bicycles is N plus one, where N is the number of bicycles you currently own, and N plus one is the number of bicycles you need to own.
Right, right. That's that's great. So, cycling is one. Which other sport do you play any other sport now?
No, I don't. I don't do any other sports now. I played baseball all through elementary school and all the way up to college.
Okay.
I miss playing baseball. I wasn't particularly good at it. I don't think. But no, no other sports. Just cycling. I I like the idea. My best ideas come to me when my brain is completely focused on something else.
Okay.
And so, you're in the middle of cycling, and your brain just kind of turns off, and then somewhere in the reptile part of your brain an idea comes, and you stop. I mean, I'll actually stop and I'll send myself an email or send myself a note so that I don't forget when my brain turns off again and I'm finishing the ride.
Right, right. So, and apart from cycling, any other hobby which you pursue or are good at?
Boy, those are different things. I do play guitar a little bit. I don't know whether I'm any good at it. We do have a band, though, at American Hernia Society.
Oh,
We have a band called Loss of Domain.
that's great.
And we're currently on a world tour. We've played Nashville, we
Uh,
played in Romania, we were in Mexico. So if you need entertainment at your next meeting, this is anybody who needs entertainment at their next meeting. Please send me an email. Loss of Domain Band. Yeah.
That's great. I think a band naming loss of domain on. I think we can ask him to come for the
Oh
AWSC
yeah,
with
we
the
got we
band
got
next
we
time.
got merch. You let us know. We'll set up a table and sell some merch.
Great. So, what about your family? How much you're able to balance out your work, your hobbies, and your family time? Who all are there back home?
Yes, so I think it depends on who you ask. You're asking me how I balance it out, and I balance it out amazingly well. If you ask them, you might get a different story.
Yeah, I
So
think that's everybody's story.
it's true.
Yeah.
So my wife is a maternal fetal medicine physician.
Oh, great.
So she does high risk obstetrics. We have the privilege of doing some cases together sometimes.
Oh,
On Monday, before I left for this trip here, we did a C-section together.
Okay.
The patient had some hernias from a previous C-section, so I opened. She did a C-section. I fixed some hernias on the way out, so it's kind
Oh,
of fun to work together. And then I have only one child. I've got a daughter who is a first-year student in university at George Washington University in Washington, D.C.
she's doing medicine.
No, no.
Oh.
She has seen enough medicine in her lifetime to know that she doesn't want to do medicine. She's studying English and creative writing.
Great. I think now more and more kids are taking up different, branches and all, especially with the couples who are both of them are doctors. The high intensity environment at the home may little bit push them towards that.
Yeah, she is and has always been a very creative, art interested person. She is a dancer. She has always created art. She enjoys creative writing. So she's going to do something with that skill. I don't know what it is. I hope it's something
No,
amazing though.
definitely she'll
Yep.
do something.
And then we have 3 dogs.
Oh,
So the dogs take up a bunch of time as well.
so how you are able to manage all of this? I don't have a pet at home, but I think having a dog is a full time investment in itself. So three,
Yeah. So you have to have a dog sitter at times. Yes. And
right?
you have to have a wife who also helps manage the home. My wife does a lot more work than I do. I mean, like I get to travel all over the place, and she holds down the fort.
Right, right. I think any success without having that anchor at home, it becomes a little challenging,
It
more
can be.
challenging.
Yep, for
Right,
sure.
right. So coming back to surgery, so do you remember the most difficult surgery you've ever done? You've kept in your mind, maybe. I know you. I have seen your videos. There, for us, most of them are challenging, but like for you, the one case,
Yeah.
one patient.
I mean, honestly, I don't know that I could answer that question. I get asked to help fix a lot of complex people, and I mean, some are more memorable than others. One that comes to mind is a patient who had an esophagectomy and had an anastomotic leak into his right chest, and we did some endoscopic vacuum therapy for him, and it took more than 2 months of therapy to get him better. I mean, I have his name and his date of birth and his medical record number memorized
So
because I did the safety timeout in the operating room so often that I still know it. And he got better, right? And he lives local. He rides his motorcycle around town, and I see his personal family doctor from time to time because he has some overlap with some functions at my daughter's school. And every time I would see him, he would say, "Hey, I saw our shared patient, and he's doing great. I just want you to know."
right.
So it's kind of fun to know that like he's out there riding his motorcycle and like living his life after 3 months of like challenging therapy.
Absolutely. I think this is what make us and can keep us going, these memories. So apart from the most difficult, the funniest memory in the OR,
Funniest memory in the
of the
OR.
funniest story.
Boy, there's a ton of them. I don't know about that one. Um, uh, I uh, I had just come back from a trip and I was operating and I was feeling unwell, like I needed to vomit. And I told the team, I'm feeling unwell. Like we're gonna do the case. I'm here, but like just if I step back from the table, like just it's like
Hmm.
that's why. And they said, "Don't worry, we got you." And I turned around and they had taken one of the biohazard pails and they labeled it Dr. Pauli's puke bucket. So they were ready. That sticks out as a
Funniest.
particularly funny moment.
Right. Okay. So just to know for the younger surgeons, how do you manage failures in surgery? What is your secret mantra?
Well, the secret is to realize that most of life is learning from your failures. Yeah, I mean they are all an opportunity to learn something and to get better at what you do. I think it's also important to realize that every surgeon has failures, every surgeon has problems, every surgeon has complications. And I love talking about complications at meetings because um, after I give a talk like that, almost always somebody comes up and said, "Hey, I've had that exact same problem." And I think you realize that these are universal issues, and that surgeons who say, "I don't have that problem, I've never had that issue," either they're not operating or they're being disingenuous about what
Yeah.
their own skill sets are. So I mean, surgeons in general do this very well, right? We all have morbidity and mortality conferences. We talk about our problems. We try to learn from our problems, and we try to share. Like, if I can tell you a problem that I had, so that you can learn from
From
my
my
mistake, and then not do the same thing, then indirectly I've helped other people, by sharing my problem. And I have, again, I've got a lot of patients who've had problems and complications after things that I've done. The difference between an expert and someone who's not an expert is I have pictures of all my complications, and I'm willing to share them with other people. But I also tell my patients who've had complications, when I'm asking if I can take a photograph of a wound, I explain to them why I'm taking the photo. I'm taking the photo so that I can show this problem and how we managed it to somebody else down the road. And I've got a series of patients who know that I talk about them. I've got this patient named Betty who she's been a patient of mine for a long time, and every time I see her, she says, "Hey, have you shown my pictures at a meeting anytime lately?" And so she knows, and she asks when I'm places talking. So I think that allows the patient to understand my surgeon is not only helping me with the problem that I have, but is also using it to teach other people. I think the patients get value in that. It's a way to salvage a pretty bad situation.
I think that's a brilliant message. So we'll just wrap it up. I'll take another 2 minutes of you. So we'll have a rapid fire round. I'll ask you 10 questions, give you two choices. You just have to answer, give me one word answer, and start when it comes to your mind. Okay.
Let's start the rapid fire round.
So coffee or tea?
Coffee. Black.
Beach or mountains?
Beach.
You are a morning person or a night owl?
No, I do not get up in the morning. That's how I knew I wanted to do surgery, because I was willing to get up early to do it. But I'm a night owl.
So music in the OR, yes or no?
Sometimes. Open surgery, yes. Laparoscopic surgery, robotic surgery, no.
So do you get to stop the music in between sometimes when you're operating?
Not really. I mean, if I really need to focus, I'll ask them to turn the music off.
Yeah.
But I love music.
Yeah.
I love music. I love live concerts. I don't listen to music that I particularly enjoy in the operating room. We put music on so that everybody can kind of listen to something. Like, we listen to Katy Perry radio in the
Oh.
I don't. No offense to Katy Perry, if you're watching. No offense. I'm not a big fan of Katy Perry music or Katy Perry radio, but like, it's innocuous.
Who's your favorite musician?
It's a band called Frightened Rabbit that no longer exists anymore.
Oh, I'll go and check them out.
If you develop clinical depression as a result of this recommendation, I'm not responsible. I'm not responsible. I'm telling you, I'm warning you, be careful.
Fine. What's your favorite comfort food?
Cheese.
Cheese. Great. Hobby you secretly love? It won't be secret once you tell.
Does sleep count?
Oh, yes.
Oh, yeah.
Why not?
I love
Yeah.
sleeping.
Yeah, right. Netflix or books?
Neither.
Oh, then okay. Then I think cycling and guitar.
Yeah.
cover
Yeah.
that.
I mean, I don't read as much as I would like to, but I also don't really watch movies.
Okay. And the best vacation place you've been to? The best place?
Oh, yeah. Nantucket.
Oh, nice. Great.
For those of you who don't know, Nantucket is an island off the coast of Massachusetts, which is next to Martha's Vineyard, which people know, but Nantucket is better.
Great. So, if not a surgeon, what would you have been?
Homeless, potentially. Is that?
It counts. It counts.
Yeah.
It surely counts. Yeah. One word that describes you outside the hospital.
Ridiculous.
Okay, we can take that. So we'll end this up. I think I'll just ask you one thing. that when people think about you later on, later at the later stage of your life, and not about the titles, not about your publication, just the person Eric, what do you hope that would be?
I just hope they think that I was an okay person. Yeah, I mean, I tried my best to take care of people and teach other people how to do the same thing. That's it.
So we'll end up this now. Thank you so much.
Thank you.
Had a great
Appreciate
conversation
it.
with
Good
you.
questions. Thank you.
Thank you.